I'm Dr. Jared Bonaquisti. I'm a physical therapist at Kinetic Physical Therapy, and today our presentation is going to be on telehealth and what you need to know. So the first thing we got to address is what is telehealth. Definition-wise, it's the use of electronic information and telecommunication technologies to remotely provide healthcare information and services. Now, all this information is from the APTA, right, from the American Physical Therapy Association, and the idea behind telehealth and the benefits of it is that it can, reduce costs. It can make it easier for patients who don't have as much flexibility during their day, but still require physical therapy. Any shortages in that patient's area, if they can't find a physical therapy provider, or it's challenging getting to that location, they can use telehealth as a way to still see their physical therapist, still benefit from physical therapy, and still progress with their plan of care and their exercise programs. The other benefit of telehealth is that it allows for quicker screens, quicker assessments. It allows for more collaboration between orthopedic surgeons, primary care physicians, and physical therapists so that they're all on the same page to make sure that that person is getting the best care that they need. Physical therapy-wise specifically, quicker screens mean that you can get into the office through the telehealth, be able to find out kind of what's going on, get your questions answered about those aches and pains, and then be pointed in the right direction, whether that be, hey, come right into physical therapy, or you may need to get this looked at by somebody else first before you return. So who covers a service like this? Most insurance companies in the wake of COVID-19 have adapted their laws and regulations to include physical therapy in these covered services. That includes every treatment, that includes initial evaluations. On the right, you see a list of kind of the big healthcare insurances that cover telemedicine, right, or telehealth. And these are some of the ones that we see at Kinetic in the area, and they've been on board with this sort of service for a while now. One of the newer ones that just came out is Medicare, and they currently they cover initial evaluations and they cover follow-up appointments for physical therapy, and that's as of May 2nd. They also cover e-visits, which is a little bit different. It's more of communication through email or phone call rather than telemedicine, which has to include, right, that virtual, in-person, audio, and video communication. So how can telehealth help you? Physical therapy remains extremely important, even during this time of social distancing and stay-at-home orders. The pain that you have now is not going to disappear just because of the inactivity that you're doing. It may lessen a little bit because you're not doing as much, but that knee pain, that low back pain is still going to be there. And when you return to your normal activity, that pain level may rise or may get out of control to a point where now the functional limitations are affecting your activities of daily living, right, or your daily life. So, getting to see a physical therapist, even with having to stay at home, is still extremely important. The other thing is that if you don't have pain now, pain may arise as you do more of those household activities, as your daily life changes, as your deconditioning begins because the gym that you always went to 5 days a week is now closed and you don't have the same equipment at home, and now it gets harder to find those exercise programs or to do those workouts. So as you get deconditioned slightly, pain levels may come on then. So being able to access a physical therapist using telehealth, again, is extremely important to your well-being and to make sure that you fend off those pain levels so that when the stay-at-home is lifted, when the social distancing is lifted, you're not letting pain now keep you out of those activities for longer. So, going on, how can it help you continued, right? Look at it from a different side of, your orthopedic surgery, right, that you may have had scheduled for January, February, March, or April, is that being postponed indefinitely? Do you even know when that's happening, when it's going to occur? Prehabilitation has been shown to improve post-surgical outcomes, decrease pain prior to surgery, and improve functional mobility prior to surgery. So going in the best possible condition only leads to great outcomes after. It's not 100%, but the research is overwhelming in the fact that prehab has been shown to improve those surgical outcomes. So let's use this as an example. If you go through your total knee replacement, right? You had it scheduled for March, got postponed indefinitely, you were having a lot of pain because you were waiting for the surgery, you were decreasing your activity levels, you were kind of just waiting for this to occur. Now, are you going to continue to get painful, continue to have your joints stiffen up, continue to not do the activities that you need to at home, or you can use physical therapy to help push you in the right direction and get better, decrease the pain levels, improve the range of motion before that surgery occurs. In some cases, you may not even require surgery due to your improvement. We see this a lot in people who come into the clinic for prehabilitation before their surgery. They get to a certain level where they actually feel like they can postpone the surgery themselves to a later date when they feel more comfortable. This also will save time out of work for you. It's going to save money, right? Making sure you don't have to, pay your hospital bill, right, being in there, or pay any of the co-pays for all the follow-up visits, x-rays, MRIs. And it's going to save you the stress of having to return to work, right, being under a timeline, and it's going to save you from the stress of always thinking about any limitations that were placed on you post-surgery. An example of this would be, lumbar, low back surgery, Some doctors, right, some orthopedic surgeons will put limitations on what you're able to do, and they may keep those limitations on for 4, 6, 8 weeks, depending on your healing and who you are. That's a lot of stress because now at home you got to think about, well, I used to be able to do this by myself and now I have someone to help me. I need someone to do this. I can't do this. That plus not being able to go outside or do any of these activities that you need to in or outside of the house can be very stressful. So being able to save on some of those and improve either before surgery or to push surgery off even longer is only a benefit to you. So what the research shows, again, this source came from the APTA, and it focuses on, here are 2 examples of many that the APT had on how telehealth improved these patients' activity levels, their outcome measures, range of motion, strength, to a point where they were able to, return to some activities, but mainly just improve their overall well-being. If you want to look more in depth onto this research here, you can go to the APTA's website and you can find that information in their telehealth section. So that all being said, don't wait for that pain to get worse, to now it's limiting your everyday function when before it was just limiting you a little bit. Let's get started today. Don't wait for that surgery to occur. Don't wait for that pain to get worse. You can contact us, find a clinician today at www.kineticptpa.com, or you can call our Chester Springs office at 610-458-6464. You can set up that free screen like I mentioned earlier, right, to get that assessment, or you can set up your evaluation for your prehab or for just to get into physical therapy so you can get on the road to recovery. I hope that this presentation here was educational for you guys. Again, if you need anything, please let us know. You can always reach out to us at Kinetic, or if you just reach out to any physical therapist you've gone to before, that's what we want to do. We want to promote physical therapy to make sure that when these stay-at-home measures get lifted, you're not getting held back because of pain and limitation. All right, thank you guys for listening. I really appreciate it. and reach out if you need us. Thanks.